We welcome next Martinique. We welcome next Anguilla. Ladies and gentlemen, let's welcome the British Virgin Islands. St. Vincent and the Grenadines. St. Lucia. St. Kitts and Nevis. Montserrat. Grenada. Last but certainly not least, Dominica. Let's all stand for the national anthem.
Isle of beauty, isle of splendor, isle too also sweet and fair. All must surely gaze in wonder at thy gifts so rich and rare. Rivers, valleys, hills, and mountains, all these gifts we do extol. Healthy land, so light of fountains, giving cheer that warms the soul.
Please remain standing for the invocation.
We take our authority from the scriptures. John 10:10. The thief came to steal, kill, and destroy. But I came that they may have life, life in its fullness. Standing on this, we thank you, Lord, at this moment. We thank you for the love you have for humanity, for sending down your only Son, John 3:16. Come and show us the way. The only begotten Son of God, Jesus, came in humility. We pray at this moment, and as we thank you for the gift of all of us here and our offices, that we use it to serve humanity in humility, so that God, the kingdom of God, can dwell among us. In all these nations that their flags are flagging up here, that your kingdom will be here among us, that we see one God, one people, one Lord, O God, unconquerable, invisible King, victor ever glorious, you hold in check in forces bent on dominating us. You overcome the creator of the raging enemies. Your power, you beat down the wicked foe. Humbly and fearfully we pray to you, O Lord, to send down your holy angels, grant us divine security in this environment, give us wisdom, and then your Holy Spirit be with us. Fill us up with the Holy Spirit. Have wisdom and then the gift of humility to serve humanity. In the name of the Father, and of the Son, and of the Holy Spirit. Amen. The Lord be with you.
Thank you so much. Please be seated. Honorable Roosevelt Skerritt, Prime Minister of the Commonwealth of Dominica. Honorable Dr. Ellis Webster, Premier and Minister for Finance and Health of Anguilla. Honorable Cassandra Laville, the Minister for Health, Wellness and Social Services. Other honorable members of Cabinet and members of Health and Ministers of Health of the OECS. Your Excellencies, the members of the Diplomatic Corps. Dr. Amalia Del Rego, the PAHO WHO representative for Barbados and the Eastern Caribbean countries. Mrs. Cicera Simon, Head, Human and Social Division and representative of the Director General of the OECS. Dr. Laura Esprit, Permanent Secretary in the Ministry of Health, Wellness and Social Services. Dr. Lenora Favrier-Drygo, Chief Medical Officer Acting, other permanent secretaries present, Father Paul Obiora, staff of the OECS Commission, the Dominica Cadet Corps, other invited guests, members of the media, ladies and gentlemen, good evening. Good evening. As we begin our ceremony, I'd like to introduce Dr. Laura Esprit to give the welcome remarks.
The Honorable Roosevelt Skerrit, Prime Minister of the Commonwealth of Dominica, the Honorable Dr. Ellis Webster, Premier and Minister for Finance and Health of Anguilla, Honorable Cassani Laville, Minister for Health, Wellness and Social Services, other honorable members of Cabinet and Ministers of Health of the OECS, Your Excellencies, the members of the Diplomatic Corps, Dr. Amalia Del Riego, PAHO WHO representative for Barbados and the Eastern Caribbean countries, Mrs. Cicera Simon, Head of the Human and Social Division, and representatives, of course, the representative, of the Director General of the OECS, Dr. Lenora Favrier-Drygo, Chief Medical Officer, other permanent secretaries, staff of the OECS Commission, Ms. Sheena Harry, or Dominica Cadet Corps, other invited guests, members of the media, ladies and gentlemen, welcome and good evening. Good evening. It is a privilege to extend a warm welcome to you this evening as we convene here in the beautiful Commonwealth of Dominica for the 37th OECS-PPS Policy Board meeting and the 10th meeting of the Council of Ministers of Health, all in an effort to discuss vital matters affecting health systems and to explore collaborative strategies for the benefit of our member states. Firstly, please join me with expressions of gratitude to the Honorable Cassani Laville, Minister for Health, Wellness and Social Services, for graciously hosting both meetings here in Dominica, along with the unwavering support of the Cabinet, led by the Honorable Prime Minister Roosevelt Skerrit. The commitment of your presence here exemplifies the dedication and unity we share in our joint regional pursuits of improved health and wellness outcomes for the people of the region. To all our esteemed delegates, we are excited to have you. We are assured that your insights will be invaluable as we navigate the challenges and opportunities that lie ahead in our collective efforts toward efficient and effective pharmaceutical procurement practices, and of course, explore other pertinent matters under the vast umbrella of health. It is my fervent hope that each of us leaves with renewed vigor and a renewed sense of purpose upon which to act in the best interest of our people, which is our ultimate mission. On the softer side of things, allow me to introduce and welcome you to where I live, the nature isle of the Caribbean. Dominica, our island, is famed for its stunning mountains. I'm sure you would agree. Lush rainforests and cascading waterfalls, and most of all, our hospitable people. Delegates, guests, I encourage you to take a moment after our meetings, notice I said after our meetings, if possible, or return soon thereafter to explore the breathtaking beauty of Dominica, our gem, often referred to as nature's playground. If you arrived during daylight, you would have witnessed a magnificent view from the airplane, and I assure you that the splendor continues on the ground. To our Antigua and Anguilla delegates, this is for you. We dare you to explore the world's longest aerial cable car located in the Roseau Valley. As you glide through the lush landscape, tease your taste buds with our local delicacies of akras, agouti, avocados, and apricots that await you. To our delegates from the British Virgin Islands, hiking to the world's second largest boiling lake is a sight to behold, simply breathtaking. Alongside it, marvel at the beauty of the Boeri Lake and the enchanting Brandy Falls, experiences you won't want to miss. Grenadian delegates, we are thrilled to invite you to our renowned Girardel Flower Show, where the tropical beauty of our flora is on full display. Join us as we share our progress in harnessing geothermal energy, a most exciting endeavor for our island, allowing your exploration to lead you to the nearby gorge, the T2 Gorge, while you're there. Delegates from Montserrat, we humbly invite you to explore the magnificent Mont Diablote, or tallest mountain in Dominica. Rejuvenate with the natural spring water from the Mont Wapiton and be mesmerized by the breathtaking views of the Middleham Falls. To the delegates from St. Vincent, if you were to dive into the wonders of the S destinations, I would tempt you with visits to our hot and cold sulfur springs and spas, the stunning Sari Sari Falls, or a scenic drive to Scott's Head to witness the often dramatic relationship between the raging Atlantic Ocean, aka the wife, and the serene Caribbean Sea, aka the husband. Or if you prefer the letter V, I encourage you to explore the beauty of the Victoria Falls, or dare you to visit the Valley of Desolation. St. Lucian delegates, Sakafet. Whether you prefer snorkeling, sea diving, the spectacular view of whale watching in Soufriere, or the lake in Loda, river tubing on the Layu River, the choices are abundant. For a taste of local cuisine, indulge in lamoui with zabuka, pepper, and salad, or simply palais creole, and we'll understand. St. Kitts delegates, we do not recommend any S destinations, as we eagerly await your visit to the Kalinago territory, home to our native Kalinagos with a K. Your exploration of this rich culture is essential for an unforgettable experience. And to our partners, there is no reason to feel left out. CAHO and CAFA teams are invited to visit the captivating Champagne Reef to the south, or the Cabritz National Park, where Fort Shirley stands proud in the north, just a stone throw away from here. Afterward, I recommend you to savor local callaloo with smoked meat or crab backs, a culinary experience second to none. For PAHO delegates, the picturesque Purple Turtle Beach is within walking distance here in Portsmouth, our second town, bearing in mind there are no purple turtles there. Alternatively, you may be delighted by the sight of pretty parrots soaring through the rainforest, or a visit to one of our natural pools coined with emeralds, a truly pleasurable experience. And finally, to our delegates from the OECS-PPS and the OECS Commission, I am sure you will agree that we are the Isle of Beauty, the Isle of Splendor. We are the only isle with 365 rivers, the only flag adorned with the graceful Cicero parrot, and home to the only Thea Lafont, our gold medalist. Ladies and gentlemen, in closing, I invite you all to embrace the spirit of collaboration and camaraderie that epitomizes our Caribbean family. Once again, I welcome you to Dominica as we look forward to productive discussions and meaningful connections throughout our time together. Let us work hand in hand to forge a brighter, healthier future for our Caribbean people. Thank you.
Thank you so much, Dr. Esprey. And now that we've had this tour of Dominica, I would like to give you a little taste of the culture of Dominica. And so we invite the Pebush Cultural Group to give a little bit of entertainment.
Thank you so much, gentlemen. Of course, we'll hear a little more from them a little later on in this evening's
program. At this point, we welcome Mrs. Sisra Simon, who is the head of Human and Social Division of the OECS Commission, and she's also here representing the Director General of the OECS.
Thank you, Madam Chair. Honorable Roosevelt Skerrit, Prime Minister of the Commonwealth of Dominica, Honorable Dr. Ellis Webster, Premier and Minister for Finance and Health of Agriculture, Honorable Cassini Laville, Minister for Health, Wellness and Social Services, other honorable members of Cabinet and Ministers of Health of the OECS, Your Excellencies in the members of the Diplomatic Corps, Dr. Amelia Del Riego, Paho Wu, representative for Barbados and the Eastern Caribbean, Ms. Karen Prevost, Acting Secretary to the Cabinet, Dr. Laura Esprit, Permanent Secretary, Ministry of Health, Wellness and Social Services, Dr. Lenora Favre Driego, Chief Medical Officer, other permanent secretaries, Father Paul Obiaro, staff of the OECS Commission, Ms. Sheena Harry, Dominica Cadet Corps, other invited guests, members of the media, ladies and gentlemen. I bring you greetings and these remarks on behalf of the OECS Commission's Director General, Dr. Didicus Jules. It is indeed a pleasure to welcome all of you as we come together to address one of the most critical issues of our time, healthcare access and delivery. We gather here to reflect on how we can break down barriers in our healthcare systems and at the same time empower lasting change, ensuring that no one is left behind. Change is constant, and in the health sector, its constant is too little of a word to describe it. Because we continue to confront several issues and challenges. The rising prevalence of non-communicable diseases, along with antibiotic resistance and infectious diseases, are among the new and long-lasting problems we face. Innovative thinking is essential for a successful response, particularly in the context of regional integration, which is a fundamental strategic objective for the OECS Commission. We all know too well the barriers we face in accessing and delivering healthcare, both as individual nations and as a collective region. Structural challenges rooted in our geographic size, fiscal constraints, and our susceptibility to climate change pose significant obstacles. The effects of natural disasters, such as the passage of Hurricane Beryl in recent time, further compound these challenges, making it even more difficult to ensure equitable healthcare access. At the household and individual levels, these barriers are further amplified by both intrinsic and extrinsic factors. Public health threats, whether emerging or long-standing, such as cardiovascular diseases, is responsible for almost 30% of deaths in our region. And this demands urgent attention. Diabetes, cancer, and chronic respiratory diseases continue to strain our healthcare systems, while environmental factors such as pollution and climate change further exacerbate these issues. When we speak about healthcare access, it is important to recognize the interconnectedness of the 4 A's: accessibility, availability, acceptability, and affordability. Too often, we address these factors in isolation, without fully considering how they interact. Economic barriers, for example, remain a significant challenge. Families bear a heavy financial burden as out-of-pocket healthcare costs can reach almost 55% of total health financing in certain countries, as reported by PAO. Efforts to provide fair access are further complicated in underserved and rural communities due to geographical and cultural limitations. So how do we move forward and empower change in healthcare across our OECS region? 1, we must begin by leveraging technology. Innovations such as telemedicine, mobile health platforms, electronic health records offer opportunities to streamline services, making healthcare more patient-centered and accessible, particularly in remote areas. Equally important is the political commitment. As a regional bloc, we have the power to drive these policy changes that reflect our shared priorities and goals. 2, community involvement must also play a central role. Empowering individuals to take responsibility for their own health is critical to fostering a culture of well-being. This is in line with the old saying, prevention is better than cure. This is a fundamental principle, or should be a fundamental principle of modern healthcare. At the same time, we must strengthen strategic collaborations across sectors, harnessing partnerships that allows us to share resources, knowledge, and expertise. Finally, we must embrace innovative models of care and improve the metrics we use to measure success. Better data means better decision making, and this will translate to healthier outcomes for our people. This year's theme compels us to adopt a multidisciplinary approach to healthcare access and delivery, one that embraces equity, inclusivity, and innovation. It is a call to walk the talk, to leave no one behind, and to address our unique challenges with data-driven interventions that will promote lasting change. As I conclude, I am pleased to announce that the OECS Commission, in collaboration with PAHO, will soon launch initiatives focused on disease elimination and better care for non-communicable diseases. These initiatives will promote the exchange of experiences and best practices among member states, build capacity for disease elimination, and strengthen our institutional roles in advocacy. These efforts will be key in addressing some of the critical challenges highlighted today. Over the next 3 days, we will be engaged in discussions on identifying more barriers and empowering change in our healthcare system, access and delivery. I hope that we will all be able to contribute to finding effective solutions to improving access to quality healthcare and delivery. Thank you for listening.
Thank you so much, Mrs. Simon. I wish to apologize this evening on behalf of Honorable Vincent Whitley, who is not with us. He is the outgoing chair. Unfortunately, his flight got canceled, so he was held back. So on behalf of Honorable Whitney, apologies, but I would like to welcome the incoming chair of the Council of Ministers for Health, Honorable Cassani Laville, Minister for Health, Wellness, and Social Services, Dominica.
Thank you very much, Madam Master of Ceremony, Honorable Roosevelt Skerritt, Prime Minister of the Commonwealth of Dominica, Honorable Dr. Ellis Webster, Premier and Minister for Finance and Health of Anguilla, other honorable members of cabinet, and distinguished ministers of health in the OECS. I see my dear friend and colleague, Minister Telesford and Kernan, Your Excellencies, and members of the Diplomatic Corps, Dr. Amalia Del Riego, PAHO WHO representative for Barbados and the Eastern Caribbean countries, Mrs. Simon, Head, Human and Social Division and representative of the Director General for the OECS, Dr. Laura Esprit, Permanent Secretary, Ministry of Health, Wellness and Social Services, Dr. Lenore Favria-Drygo, Chief Medical Officer, other distinguished permanent secretaries, Dr. Donald Peters, Chair of the Dominica Hospital Authority, CEO, Dominica Hospital Authority, directors and senior administrative staff at the Dominica Hospital Authority, Father Paul Obiora, staff of the OECS Commission, Master of Ceremony, Dominica Cadet Corps, other invited guests, members of the media, ladies and gentlemen, good evening to all of you. It is my distinct pleasure to address you today as the incoming chair of this esteemed council and as the host country for this year's gathering. Welcome to our beloved island. You join us during a time of festive seasons, a time of year where we celebrate this year, at least our 46th year of independence. This year, we commemorate and think and celebrate under the theme, Peinu, Kadunu, meaning our country, our gift. In Dominica, we are not only grateful for this gift, the Nature Isle, but also for the enduring relationships, partnerships, and collaborations forged over the years, especially with our fellow OECS countries. These bonds have been crucial, providing support in both tangible and intangible ways, particularly in the healthcare sector, which I have the privilege of leading. Through the OECS pooled procurement services, our shared goals and interests remain paramount. We are thankful for the direct support extended to Dominica and other OECS countries, and we are confident that our collaboration will continue to strengthen moving forward. Small island developing states benefit immensely from this facility, as it enables fair and transparent procurement processes without straining our limited resources. Our partnership with the Pan American Health Organization further enhance our capacities to sustain robust health systems. The PAHO Strategic Fund, part of the Regional Revolving Fund, offers us another technical cooperation mechanism for pooled procurement of essential medicines and health supplies. With these two exemplary mechanisms in place, our region is on a firmer footing in our quest for universal health care. It is, however, important, though, that we continue to strive to build even more synergies between PAHO's Strategic Fund and OECS pooled procurement services. A more collaborative approach will yield increasing efficiencies, broaden access to pharmaceutical markets, and lower unit cost by increasing procurement activity by widening the pool. Our ultimate goal is to achieve even more with the support of regional partners for the benefit of all small island developing states. I am extremely happy to be the champion of this collaboration in my chairmanship this year. And that is why I look forward particularly tomorrow to the launching of the Country Cooperation for Health Development, which will achieve these objectives. I would also like to acknowledge the exceptional leadership of my dear friend and colleague, Vincent Whitley, who unfortunately was not able to be here. I recall him last week at Directing Council meeting in Washington, D.C., and he was extremely excited to be here in Dominica. But as fate would have it, he's not here tonight. I do hope he can join us at some point during the week. I certainly would like to commend him for his hard work in preventative healthcare, particularly in addressing issues related to cervical cancer. And this is an absolute testament to his profound dedication. As a region, we recognize the pressing challenges posed by chronic non-communicable diseases, with cancer being one of the most alarming. Over the next few days, we'll delve into a profound theme that transcends geographic boundaries, beyond borders, breaking barriers and empowering change in healthcare access and delivery. It is imperative that we recognize healthcare as a fundamental human right, deserving of accessibility for all, regardless of where we were born, where we were from, or our financial circumstances. In a world where we travel and connectivity has become even simpler and tech advances have virtually eliminated borders, we must ask ourselves, why do barriers in healthcare still exist in certain parts of the world? Why do millions still lack access to basic healthcare globally? These disparities are often amplified by socioeconomic statuses, geography, and systemic inequalities, alongside the profit-driven motives in some parts of the global medical industry. It is our duty as colleagues gathered here today to confront these gaps in our region and ignite the change that is so desperately needed. Let us take action on this responsibility together. By continuing to share knowledge, resources, and best practices, we can create a more equitable healthcare system that empowers individuals and communities to take charge of their health. Here in Dominica, our government, under the strategic leadership of our Prime Minister Skerrit, has made significant investments in health to ensure that every citizen has access to quality healthcare. We know the financial challenges that entail globally and regionally, and we know the inherent competition that may exist with productive sector like tourism, agriculture, and healthcare. But this Prime Minister, this cabinet, under this leadership, we have prioritized healthcare because there's no productive sector without the underpinnings of a strong healthcare sector and a strong people. Recognizing the need for improved facilities, the government has constructed 12 new modern health and wellness centers, increasing access with a ratio now of 1,428 people per health and wellness center. This administration has also invested more in hospital services than any previous administration. Since entering into diplomatic relations with the People's Republic of China in 2004, we have gained a lifelong development partner, resulting in far-reaching benefits for secondary and tertiary healthcare systems. The Dominica-China Friendship Hospital, a state-of-the-art facility, features 7 new medical buildings, including an accident and emergency department, operating theaters, and ICU. The radiology department offers 5 imaging modalities to include MRI, CT, X-ray, fluoroscopy, and ultrasound. We are very proud to have 5 Dominican radiographers, the highest ever in terms of local radiographers serving our hospital or serving our people at any given time. In 2023, the hospital treated approximately 15,000 outpatients across various specialties, including general surgery, ophthalmology, ENT, urology, orthopedics, anesthesiology, obstetrics, gynecology, cardiology, and pediatrics. Many of these services are provided at much lower cost than in the private sector, with no fees for people aged 60 and over and 18 and under. We are well on our way, as you see, to achieving the SDGs way before 2030. We are very fortunate to offer access to visiting specialists in cardiology, ophthalmology, and urology. The Chinese medical team has been pivotal in developing our cardiology services, establishing the Dominica China Telemedicine and Imaging Cardiology Center. This facility enhances our cardiac imaging capabilities, including advanced procedures for better diagnosis. Additionally, many of our specialists are trained through a diplomatic relationship with Cuba, enabling us to offer a wider range of specialized medical services, including nephrology, intensive care, and even neurosurgery, which we started just over a year ago. In the past year, the government has approved salary increases from 6 to 12% for public officers, including nurses and doctors, and appointed nearly 60 nurses to our healthcare system recently. This reflects our absolute commitment not only to the health needs of our population, but also to the welfare of our hardworking healthcare professionals. I know it is late. You've been here for some time. I could go on and on with our milestones, but this is more than just a summary. It is a catalog of our commitment to the people of the Commonwealth of Dominica. So we have been doing our little part in the OECS region, and we will continue to do just that. I look forward to fruitful discussions in the days ahead, keeping in mind the journey towards equitable healthcare. It's not just a responsibility, but rather it's an opportunity to advocate for the vulnerable and dismantle the barriers that hinder our development as a people. Dominica is thrilled to be the host of this year's Policy Board meeting and Ministers of Health Council meeting. Together, we are not merely discussing the future, but in fact, we are actively shaping it, driven by transformative change in healthcare access and delivery. Let's seize this opportunity to make a lasting impact for all of our people. Thank you.
Thank you so much, Honorable Kasani Laville, incoming Chair and Minister for Health, Wellness, and Social Services, Dominica. At this point, I direct your attention to my right, your left, as we invite Tasha P. and Peter Leta for a little bit of entertainment this evening.
Good evening, everyone. You all look like you want to sleep. But we're going to give you a little bit of entertainment. Hopefully you guys can sing along with us. Feel happy. I'm proud to be part of this initiative tonight. And thanks for showing us so many lovely faces. I am to you good night. And to all the nurses, thank you for all your hard work. I know so many nurses want to leave up, but I'm glad you guys are still around. There's a light, a certain kind of light, it never shone on me. I want my life to be, to live with you, to live with you. And there's a way, everybody says, to do each and every little thing. But what does it bring if I ain't got you? If I ain't got you, baby? it better. Baby, you don't know what it's like to love somebody. Much better, much better. Baby, you don't know what it's like. Baby, you don't know what it's like. Almost there. To love somebody. To what? To love somebody. The way I love you. Thank you so much.
Thank you, Tasha and Peter. Well done. And thank you to the backup singers in the audience. Well done, too. At this point, we invite to give the feature address Honorable Dr. Roosevelt Skerrit, Prime Minister of the Commonwealth of Dominica.
Thank you very much. Thank you. Let me first of all recognize my friend, Honorable Dr. Ellis Webster, the Premier of Anguilla, Honorable Cassidy Laville, our Minister for Health, and Mrs. Laville, my honorable cabinet colleagues and ministers of health of the OECS, Your Excellencies, members of the Diplomatic Corps. Let me also recognize Mrs. Simon from the OECS Secretariat, and of course our dear friend from PAO. Ladies and gentlemen, friends all, good evening. I want first of all to thank the Minister for Health of Dominica for inviting me to be part of this ceremony. Though I have a problem with my voice, I decided to come because for me, health is very important. And it has been a #1 priority for this government for the last 25 years. We believe that health is at the center of the society, and to ensure that every citizen and resident has access to health care, irrespective of their socioeconomic circumstance. But I want to say to my dear ministers of health, and of course to the OECS, that I have been on a crusade in respect to CNCDs. If we thought that COVID was the major threat to us, I believe that we have been wrong. CNCDs is a major threat to us in our survival, our economic viability. And I believe that we are spending too much time on treating CNCDs rather than seeking to minimize, if not eliminate, contracting it. And therefore, we have to go back to the basics of primary health care. Now, anytime a society gets more developed and developing, people have access to money so they can go to a private physician. And they bypass the health centers in the rural communities where they could get equally the same health care at no cost to them. And so we have to find a way of reversing that attitude towards healthcare. Everybody rushes to the tertiary and secondary healthcare facilities, whether it is a simple headache that they've had for the last several days, or maybe a toothache. And there has to be greater advocacy regionally and even globally on the importance of primary healthcare. When you look at the training of nurses, we have the presence of foreign schools, nursing schools in the Caribbean, and many of our citizens quite rightly access those nursing schools. But these nursing schools, in my view, they do not pay attention to certain fundamentals of healthcare, the provision of healthcare services or nursing services. They provide nurses more for tertiary institutions, not the bedside nurses that are required, not the nurses who have to go into the communities to educate and inform the citizens on how to manage their healthcare, their health and their wellness, ensuring that they take the medication that they need. If you go to any home in the Caribbean, you will see every family in the Caribbean has their own pharmacy at their homes. Prescriptions that they've gotten, but they're not taking their medication. In many instances, they do not have sufficient knowledge of it, and there's not enough advocacy and education in the public domain of the need for them to take the medication. And so I think that we have to have a regional approach to the training of our nurses. The idea of each OECS country training nurses is not sustainable. One, you do not have access to enough lecturers to provide the tuition to the nurses at the depth and the extent to which you need them. And secondly, you will never have the resources to have a nursing school in every single island to respond to the challenges that healthcare has posed to us in recent years. The reality is, we are a less healthy and well society now than we were 20 years ago. And what are the new strategies that we could use and employ to combat this? When you take a 40-year-old with 3 children, and that person gets a stroke and is unable to work, and she's a single parent, it doesn't have to take anybody with any sense to understand the implications to the society. The implications for productivity in a society. If you take, for example, the number of sick days, which many of you in the Caribbean apply for, it is a huge cost in the treasuries of our OECS countries. But we don't quantify it. We don't quantify it. And I'm saying that there is an emergency globally, not only in the Caribbean, to fight CNCDs and to encourage wellness among our citizens. The notion that the Ministry of Health of any OECS country can cure your ailment is wrongly placed. The Ministry of Health has a role to play. The hospitals have a role to play. But we as individuals and the wider society, we have our role to take care of ourselves. And I believe that more of that needs to be said to our citizens. You hear people complain about every hospital in the OECS and the Caribbean. Rightly or wrongly, that's one argument for some other time. But we have to really, honestly, provide greater education to our people. We are not speaking enough to the society. And it shouldn't be left to politicians like me to be advocating about CNCDs and the need to take care of ourselves. The other issue that we have to address, the issue of healthcare management. There is a dearth of healthcare management in the region. And it's not the fault of anyone. The reality is you can't expect a surgeon to be a human resource manager. It's not going to work. Doctors should stay in the theater and to provide care to patients, and let us get those who want to dedicate themselves to managing healthcare, be given those roles to manage healthcare and not be at the patient bedside. And I think because doctors are there and they're all heads of departments, they have a human resource function, they have a management function. Now, because of our small size and limited human resources, all the doctors who are working in the public healthcare system also have a shingle up. They're in the private sector as well. And how do you only have 24 hours in a day, 10 of which many people used to sleep. So you're already left with 14 hours. And how do you share yourself? Plus running a family. And these days the schools give your children so much homework. How do you get time to help your children so much? So the reality is we have to be a little bit smarter in how we go about addressing the dispensation of medical care and services to our citizens. And I believe that we can reduce our budget and achieve more. But what we do to respond to challenges is that we increase our budget. But money is not the problem. Money is not the problem. Because if money was not a problem, there will be no health problems in many parts of this world, because they have resources of infinite amounts. And so I believe that we have to go back to the basics. I am a strong advocate of primary health care. I believe that this is where healthcare starts, in the communities, in the homes, in the schools. If we don't provide the children with proper meals at the schools, how do we expect them to go home and tell the parents what is a balanced diet? And then when the government try to help people by increasing the taxes on soft drinks and all sorts of things, then we, the society, make a political issue out of it. And then when people get sick and they need to find $100,000 to go somewhere else to get advanced medical care, then the government has to come in. And so we have to address this issue. In the school systems, I believe that there has to be a dramatic paradigm shift in the education system. It is not helping children, absolutely, it's not helping children. We're focusing too much on sit-down lessons before a screen or before a chalkboard, and no time for exercise, no time for talking about what is healthy, what they should eat, what they should, nutrition and welfare and well-being. And then what do we have? Yes, we have a child with 14 ones at CXC, but that child may be obese. And is that the kind of children we want to produce and develop in our society? By the time they get to working age, they're unable to produce. But they have their academic qualifications. And therefore we have to mold a holistic child. The child must be smart, but the child must also be well. Well, and I think that we have to, sorry, they gave me a very lovely speech and so on. I just feel too that we need to have a conversation about this thing. I can tell you, I am very, very concerned about the health of this society. The question is, would we allow the government, for example, to ban importation of sugar, which is the major cause of all the problems in society, and use natural sugars? Why should we have moved from 1 dialysis machine or 2 dialysis machines to 14 dialysis machines? Because we're responding to a problem. And the reality is there is not sufficient public education. So doctors, nurses, pharmacists, healthcare professionals, you have to do better than that. You can't have the knowledge and then whisper it to the ears of one patient at a time in the hospital if you have the time. There must be mass education in this Caribbean, this OECS. We must pollute the environment with education. It shouldn't take a lowly politician like myself to be the major advocate of this. And we should not get concerned only if it affects us or it's affecting somebody in our society. That's not what caring is about. And for me, because I am a strong advocate of the fight against CNCDs, I have banned the consumption of sugar and dairy products. And I make my own coconut milk, my own almond milk, and the majority of what I consume, I grow myself. So I know what 99% of what I consume comes from where I know they come from. And unless we go back to the old days, these people are parking and driving through the drive-thrus and picking up this fast foods, and then they eat it on the vehicles, and then they go home and sleep. We are in a crisis state, ladies and gentlemen. It is of crisis proportion. About 15 or 12 years ago, we met in Port of Spain, Trinidad, as heads of government, and we had the Port of Spain Declaration. I would urge the Ministers of Health for the OECS, if you have some time, to look at this declaration. It is still relevant today because the situation has gotten worse since 12 years ago in the region. And so I look forward to the communique coming from this, grouping, and I have no doubt that I will see in the communique reference to mass public education and the fight against CNCDs and the development of a wellness program. This is why we have to focus on wellness. And the response is not always to spend more to respond to a challenge, because the more we spend, the more we encourage the problem. So if you look at our budget in the Ministry of Health for pharmaceuticals, I reckon about 78% of the pharmaceuticals bill is to treat CNCDs. And we have been importing the more expensive drugs so as to encourage people to take it. But how long can this practice continue if at the end of the day, almost every one of us now is sick? And so we have an opportunity, and I meet people every day who are suffering from diabetes and hypertension. And these are very young people. These are very young people. So doctors and nurses, this is your call to action. The ministers of health can deliberate, they can set the policies, they can put aside the resources, but if we are not speaking, if we're not educating, if we're not informing, if we're not sensitizing, we'll have a problem. We do have a problem. And so we can no longer be consumers of information. We have to be producers of information. The society needs education. And because so many of us have access to the internet, and we go and we consult the internet for medical advice. And so our work now, or your work now, is much more difficult than it was 20 years ago. And this is why it requires us to be even more proactive and active in that fight. Because the reality is, if we do not watch it, we may not have pilots to fly planes anymore in the Caribbean. We may not have teachers in schools. When you call the police, they will tell you that the officer is at the hospital. He got a stroke, God forbid. The doctors themselves, they may become patients and nobody to care for them. And in this business, you never advise yourself, but if you're a lawyer or you're a physician, you're always sick. You're pretty never colleague, because that colleague might be next to you as a patient. And then when we send our children to school, the principal will call us and tell us, come get the child from school because the teacher is on sick leave. I'm not usually wrong, but I'm hoping I'm wrong on this one. We have to really take action on this. So sorry if I did not make reference to statistics and data and all these things. But unless we address those fundamentals, we'll be spinning top and mud. And people will expect, whenever they go to a hospital, whatever they're confronting, the clock should be turned backwards, and then they could go back to be healthy. It's not going to happen this way. And this is why you will find people are more critical of the healthcare system now than other times. Because everybody wants to go there and expect you can undo by one visit all of the practices they've had for so many years. And so, my dear friends, I'm not sure, I always try to study what, when they say you to give remarks or you to give an address or feature speech, I'm not sure how long it should be or what the content should say. But I wanted to share these very simple messages to you. I want to commend my Minister for Health for his wonderful address and setting the tone for the engagement over the next few days. But something has to be done. We've seen in schools, when I was at school, we had physical education, then they have now turned physical education to a CXC subject. So instead of doing the push-ups, we have multiple choice. Instead of getting children to run up the hill, they're asking what is the distance between point A and point B. And the reality is the society likes this because we have caused ourselves to be trapped in this competition and this notion that through a textbook will educate people. And then we forget the important parts of it. So physical education is now a subject at CXC. Some choose to do it, some don't, and the majority don't. And what happens? So friends, I always like the word time for action. These words. Really, I am concerned that if we do not act in a concerted effort, and this requires the concerted effort of every citizen. Every citizen. We have sought to put in some policies in the public service. For example, about 7 or 10 years ago, I put in place a policy that will allow every public officer to leave work at 2 or 3 in the afternoon to go and exercise. It was an effort to poke the consciousness of people. Usually public officers like time off. There's still a little drizzle called scary book tomorrow, But I found that very few were taking advantage of this exercise program. And then people say, well, I don't have a gym in my village or my community. We really don't need any gym. We have enough open space. But at the end of the day, each of us it's each of us responsibility to look after ourselves and to look after our families and to look after the community and to look after the nation and of course the region by extension. It's going to require a lot of collaboration. The same way we have had PPS for a very long time and there's work to our benefit, we're going to have to craft some joint strategies and programs that we can run through this OECS. And if you, the Ministers of Health, this current group of Ministers of Health, were to achieve a very clear fight against the NCDs, I would declare you the best Ministers of Health the world has ever seen. Because that is the #1 threat to our survival in the society. #1 threat. And I could spend the entire night speaking to you about this. And in my constituency, I have a program where I expose every person to a medical check. Prostate and mammogram, pap smear, to ensure that we raise the consciousness of the people. Because I am very frightened for the society. Climate change, coupled with the health crisis, people not caring for themselves, you will never have enough money to counteract these challenges as small island states like ours. There's no way. And spending more is not the solution to the problem. Really, we have to start, what they must say in double, we have to start education program, sensitization. We have to stop, we have to make some time for this, otherwise we'll have a challenge. So I wish you all the best. There's a part of the national trail that goes through the hotel property. And there's a wonderful walk you can have to the national park, the Caribbean National Park. Take you about half an hour, 40 minutes. Or if you prefer walking on the flatter side, you can use the lower part of it as well. But please, have a wonderful time here. I'm so happy to see all of you here for this important meeting. We're going to rely on your discussions over the next couple of days in shaping the cooperation, the collaboration that we need in this region. And we rely on you for that. And we have no doubt that you will rise to the occasion, as you have done in other times. So we wish you all the best. I wanted to be here to greet you, to welcome you, and to let you know that you have in me a very strong advocate for health and healthcare and access to healthcare. And the Minister quite rightly pointed out to our efforts towards universal access to healthcare. It's cost us a lot of money. It's costing a lot of money to provide free medical care to a large percentage of the population. And oftentimes, when you are faced with challenges, there'll always be people who say to you, as Prime Minister, you should cut this or cut that. But I believe that we have a duty and obligation to ensure that every citizen has access to health care. There are some of us who are fortunate to have medical insurance, and we encourage everyone to have medical insurance. But the reality is, there'll always be some in the society who will never be able to afford medical insurance. And we have to avoid what is happening in many developed countries, where people need to pay before they are provided with care. A complete reversal of the duty of a medical practitioner, that you ought to care for the patient and then talk about money. So we have to fight against this practice coming into our shores. Though there are signs of it, we have to be careful of this, that we don't demand of people to pay before we take the stethoscope and to check their lungs. That is not what I believe we were trained to do. That is not what we in the society are known for. We're known to care for people and to provide the care that we're able to, irrespective of whether the person can afford. It's like a lawyer. The lawyer has a duty obligation that if he is in the court and someone is there without representation, he should stand and offer that citizen representation. And therefore, when the patients come to you, we have to provide the care and ask for the money later. So we have to fight against this practice and ensure that this practice does not come to our shores, where people feel that they're unable to go to the hospitals or to a private practitioner to get care. And this is why we're very strong, as costly as it is, and we have remained true to this notion and this ideal that we must provide for the least among us. This is in scripture. So for me and for us in the government, it is not a political responsibility. Political responsibility only requires you for basic primary health care, or Christian duty is to ensure that we can provide care to the least among us. And that's what we have been doing in Dominica, notwithstanding the huge cost of providing the care free of charge to a wide cross-section of the society. May God bless your efforts in the OECS and OECS ministers and your deliberations over the next couple of days. I congratulate the Minister for Health, my friend Honorable Larville, for his assumption of the chairmanship. You have my fullest support and encouragement as you chair the Ministers of Health meeting. And to all of us, let us leave here tonight reflecting on our individual responsibility and to do some introspection and to see what more can we do, what more can I do to help humanity. Because as Christians, or whether you're Christian or non-Christian, we have in our minds that there is a superior being. And that questions will be asked of us. From the Christian standpoint, the question will be, what have you done for the least of my brothers while you on earth? And depending on your response, we know which gate we shall enter. I know all of us aspire to go to the gates of heaven. But you have to produce on earth before you can enjoy the bounty and the beautiful nature of heaven. Let us start with something that costs us no money. Educate, sensitize, inform, guide. Thank you very much.
Thank you so much, Honorable Prime Minister. Of course, I think I speak for us all when I say we're grateful you didn't check your notes, but you spoke so eloquently and passionately about things that we all feel deeply about. Thank you very much. Ladies and gentlemen, we welcome once again the Pebush drummers. Let's give them a round of applause, please. thank you so much to our young drummers. Of course, it's always nice to see young people engaging and upholding the rich traditions of Dominica. Thank you so much. And as we bring things to a close, let me invite the Chief Medical Officer Acting, Dr. Lenora Favria-Drago, to offer the closing remarks.
Good evening, everyone. You would think that when you hear closing remarks, there would be a louder applause, because we're done. The Honorable Roosevelt Skerritt, Prime Minister of the Commonwealth of Dominica, Honorable Dr. Ellis Webster, Premier and Minister for Finance and Health in Anguilla, Honorable Cassani Laville, Minister for Health, Wellness and Social Services, other honorable members of Cabinet and Minister of Health of the OECS, Your Excellencies, the members of the Diplomatic Corps, Dr. Amalia Del Riego, PAHO WHO representative for Barbados and the Eastern Caribbean countries, Mrs. Simon, Head of Human and Social Division and representative of the Director General of the OECS, Dr. Laura Esprit, Permanent Secretary in the Minister of Health, Wellness and Social Services. Minister, I think we lost Dr. Esprit to the Ministry of Tourism. Other Permanent Secretaries, Father Paul Obiara, staff of the OECS Commission, Ms. Sheena Harry, the Dominican Cadet Corps, other invited guests, members of the media, ladies and gentlemen. Like the Honorable Minister, I prepared a speech, but in sitting and listening to him, I think I do not want at any moment to cloud anything that he has said with just words on a paper. I would love for us to go home or back to our rooms and resonate on what it is that we've been charged with as healthcare providers. And I may be shooting myself in the foot by saying this as Chief Medical Officer, but I look forward to the tasks that come to us as technical officers coming out of this meeting. Like I said, I might be shooting myself in the foot, but I look forward to the work that has been done. I think we're all here because we're passionate about healthcare, we're passionate about our mandate to keep our societies healthy. And so with that, I will invite you to enjoy the rest of the evening. Welcome to Waiti Kubuli. Like I said, I'm not going to read any of this because our Prime Minister and the Minister has said enough to set us on a good track, on a good path for the rest of this week. So thank you for making it to Waiti Kubuli. Do enjoy our island. Please try and some of our exotic food and go take a hike like the PM instructed or invited us to do. And enjoy the rest of your night.
Thank you so much, Dr. Drago. Well put. And like she said, I invite you now not to run home or run back to your room. Before we get into the meat of things in the next few days, this is your opportunity to socialize. So I invite everyone to stay with us for a little while and meet and greet, as they say. Thank you all for coming and have a pleasant evening. Thank you.